Okay, well, welcome everybody. Thanks for joining our talk today with Dr. Nell Smircina and Dr. Tina Alidad. I want to thank you both for taking the time out of your day to discuss immunity with us. So with that, I will let you take it away.
Happy to do it. So again, welcome everybody. Thank you for joining our discussion, very timely discussion on empowered immunity. As Nick mentioned, I'm Dr. Tina Alidad.
Okay, and I am Dr. Nell. Let's go to the next slide. We're both going to take a second to introduce ourselves, but before that, Nick is going to hold questions to the end just because it's difficult switching on and switching off the host, but we do want it to be interactive. We've made this presentation short for a reason, want to make sure there's plenty of time for questions. So feel free as we go through to enter the questions in the chat so that, we have a running list when we get to that point. And we want to make it individualized. So if you guys have any questions, get, the tangible takeaways that we give on a more general level. And then also, we're happy to help on a, one-on-one, whoever's on this call.
All right, and so as I mentioned, I'm Dr. Tina Alidad. I am an advanced practice pharmacist as well as the founder of ThriveRx Wellness. The reason that I started ThriveRx Wellness was to really change current patient-pharmacist relationships. When I am working one-on-one with my patients, my few main goals are to help them to better understand their health conditions, to better help them understand their medications, as well as their overall health. I do work with two kinds of patients. Patients are on medications and patients that just want to practice preventative medicine. And my general approach is to really implement lifestyle changes as well as individualized supplementation in an effort to decrease unnecessary prescription medication use.
All right, most of you guys know me. I'm Dr. Nell, licensed acupuncturist and functional medicine practitioner. And one of my favorite quotes that it was actually someone I met at a Chairman's Circle event was like, functional medicine, what does that even mean? Shouldn't all medicine be functional? And yes, in a perfect world, it should. So that's part of the reason I founded PIQUE, which is a medical clinic right here in Beverly Hills. I really just want to empower patients who want to feel like the best version of themselves. And so we're hoping to give a little bit of that to you guys today. Really, the main pillars, this idea that performance, you can optimize your performance, whatever that looks like to you, the best version of you by, cutting edge recovery techniques and lifestyle modifications. So I always like to say, I am just a guide. The patient is the hero in their own story. And so we just wanted to give you a quick overview of who we are, why are we even qualified to be talking to you about this topic. And yeah, so let's get on into it.
All right, so first we wanted to give everybody a quick overview of the immune system. You'll see on the left-hand side is the innate immune system, and this is really our rapid response immune system. It's our first line of defense that the body sees as a threat, also known as an antigen, more scientifically. So anything that's kind of foreign to the body is a rapid response from the immune system. Then on the right-hand side, you'll see the adaptive immune system, and that's the slower response. That's more specific. And you'll see there's both B and T cells that are a part of the adaptive immune system. These are white blood cells, and coming off of the B cells are antibodies. And I just wanted to touch on them real quick, just because when we are developing a vaccine, when we get a vaccine injected, essentially it is a very small amount of active live virus or an inactive amount. And the whole goal is to mount an immune response so that the next time that our immune system does encounter this specific antigen, which can be a virus, for example, then it knows how to quickly respond.
And this idea of autoimmunity, we really wanted to give you this brief overview of the immune system because you hear a lot of buzzwords, right? And you hear about, with COVID, oh, why is a vaccine so important? So we wanted to give you a little bit of an understanding of how the immune system works. But autoimmunity is also a huge buzzword. And there's a lot of misinformation around that. So there's a difference between autoimmunity and then autoimmune disease. So with an autoimmune response or autoimmunity in general, you have antibodies that mark certain tissue in your body, whether that's, you hear of thyroid autoimmunity, think of it as little flags on your thyroid that, oh, there's a problem here, the body might be ready to attack. That does not mean you have an autoimmune disease. It just means you're marked if you have these antibodies that may come up in blood work. However, autoimmune disease is when there's actually an immune response to that. So your body follows through on those little flags on particular tissue in your body that shouldn't be attacked, that should just be allowed to be there, be staying healthy, keep you functioning. So when you have an autoimmune disease like Hashimoto's, like rheumatoid arthritis, like lupus, psoriasis, a lot of these things that, we hear about all the time, it's your body going after those markers and confusing that tissue with something that needs to be destroyed. And when we get a little bit more into the personalized approach of helping your immune system and supplementation, this will become a little more relevant. So you can go to the next slide. Okay, so factors affecting the immune system. This is actually, in my mind, something that we should be excited about. I think a lot of times when we look at this list, we think, oh my gosh, I could totally mess up my immune system so quickly because it seems like everything on here is things, that I do or that I'm exposed to. But it should actually feel really empowering, because if these are things that can negatively affect the immune system, they're things that can positively affect the immune system as well. So with all of our behaviors, we really have an incredible opportunity to affect our entire system. And when we go into later in the presentations, things about lifestyle, we're going to dive into these a little bit more. But keep in mind, we really do have a lot of power when it comes to nutrition. Every bite that we eat, we're either fighting or fueling disease. Same thing with sleep. Are you getting enough sleep? Are you getting, the proper quality of sleep? Are you exercising? Is that exercising adding to your lifestyle, or are you, overtraining or going into it with, the wrong mindset? And so it's causing more stress on the body. And then stress, we have to think about, stress that affects the entire system is going to have an effect on the immune system, and tons of toxins that, we can be exposed to in day-to-day life.
We move on. I completely agree with everything that Dr. Nell just mentioned, and I wanted to harp on the nutrition component, just because a lot of the vitamins, the minerals, the nutrients that we're getting do come from our nutrition. So incorporating both fruit and vegetables into your diet is really going to help to make your immune system more robust. And on that point, we'll get into gut and the immune system. So I want everyone to just take a moment to really think about this. 70% of the immune system is in the gut. So again, this is why you're hearing so much about the gut biome from different practitioners, and just the importance of it, because what we're putting into our gut is really affecting our immune system. And I'm going to touch more on the medications component. So medications such as ibuprofen, there is a time and place, of course, to take ibuprofen, but with chronic use especially, and not addressing the underlying cause of pain or inflammation, with chronic use, ibuprofen can compromise the lining of our gut. With chronic use, again, omeprazole, some of you might know it as Prilosec, this does over time decrease our stomach acid, and we do need stomach acid to be able to break down our food, to absorb nutrients, and if we're stopping that, we're not able to break down the food and absorb the nutrients. And this is kind of a common functional medicine phenomena, is that medications that are reducing stomach acid are not actually helping the digestion, they're almost it. And this is because they're decreasing the stomach acid. So we're not able to digest our food. Another medication, kind of class of medications, is antibiotics. So they do target specific bacteria, but again, they do also wipe out a lot of the good bacteria. So especially with chronic use, again, with antibiotics, they are affecting the environment in our gut. And the one other thing I wanted to quickly touch upon that's kind of COVID relevant is, I read this in an interesting PubMed article that is touching on this, and it's being further researched, but it's the fact that we have a gut-lung axis. So the environment that we're creating in our gut is actually affecting our respiratory system. So just something to keep in mind.
All right. And I wanted to touch on the chronic irritation of the gut lining. This can actually affect absorption. So, what Dr. Alidad was just talking about, you need this very healthy gut in order to have a healthy immune system. And so if you are not properly absorbing your nutrition, it's not going to matter how clean that you're eating if there are things that are preventing you from taking the nutrients from that food. And whether that's, the medications that she mentioned, or whether that's, chronic inflammation in the gut. I know years ago, leaky gut was, a huge buzzword, and there was a lot of going back and forth. Is this a real thing? Is this not a real thing? Is it, the root cause of, so many things that are happening in the body? Well, we do know that gut health is, at the very core, something important with overall health. And we see 70% of the immune system being in the gut. There are a lot of things, even in addition to medications, that can cause this chronic irritation of the gut lining. So, we live in California. Almost everybody's gluten-free, I think. We hear about that a lot, but there have been some really interesting studies with gluten actually in people who have a gluten sensitivity. It looks very similar to cholera, which is a disease that, we haven't heard about in a really long time. But it causes almost an infection-like process in the body. We hear a lot about the harmfulness of inflammation. And so if your gut is chronically inflamed, eventually it's going to almost give up. It's going to be fighting at these junctions where you're supposed to be getting nutrition through, creating chronic inflammation. And then it's just going to say, we can't fight this junction anymore. We just need to let things come in. And when things are able to come in, they're also able to come out. And that's the whole concept of leaky gut. Things are getting into the system that should not be getting into the system. And patients who are experiencing this generally are those patients who are showing signs of autoimmune disease or have multiple food sensitivities. So you're like, it used to only be dairy that bothered me. And now it seems like anything that I eat that's processed really causes a problem. And that's due to that chronic irritation of the gut lining. So things are getting absorbed that should not get absorbed, and things are not getting absorbed that we absolutely need for good nutrition. Okay, we can go to the next slide.
And so now we're going to speak a little bit to supplements. The one thing I do want to reiterate before we talk about supplements is that supplements are not going to take place of a healthy diet. So just keep that in mind. They are to supplement, not to, take place of a healthy diet. So the first one I wanted to speak about is vitamin D3. And vitamin D3 helps with inflammation, it helps with our immune system, and it also helps us to absorb our calcium. It's a fat-soluble vitamin, meaning that it absorbs better in our bodies when we do take it with a source of healthy fat, such as avocado or olive oil or nuts or nut butters. That's the best way that it'll absorb, is taken with fat. And I put D3 on there specifically because it is more readily absorbable for our bodies. The next vitamin is vitamin C. This is an antioxidant. This also helps us to fight off infection. And this is a water-soluble vitamin, meaning that it's best taken on an empty stomach. So that's going to be 1 hour before you eat or 2 hours after with some water. And one thing I wanted to mention about vitamin C as well is if you are taking an iron supplement, if you take these two together, it will actually help the iron to absorb better. The next one is fish oil, and fish oil helps with inflammation as well. Fish oil, a couple things about it. It is fat soluble, so again, take it with a healthy source of fat for the best absorption. A couple things that are really important with fish oil is to take a high quality source of fish oil. So you want it to be from a fish that isn't oversourced, such as like mackerel or sardines. And then the other thing is that it's going to be important that it's made in a molecularly distilled manner, meaning that it's not exposed to any heat when it is purified, because fish oil is light, air, and heat sensitive. And then the next supplement is turmeric, and Dr. Nell is going to speak a little more about this, but again, it's speaking to how it helps with inflammation. And we keep bringing up this point of inflammation because many chronic diseases do stem originally from inflammation. And I'll let Dr. Nell take that.
Okay. So with these supplements, I think, you can already see from what Dr. Tina was saying that, you can get a lot of benefit from taking these things, but there are many factors that go into the efficacy of your entire supplement protocol. So, how you're taking them, when you're taking them, how they're being sourced. And these are really good general recommendations for what I like to call immune modulating and not immune boosting. When we were talking earlier about, autoimmune patients having an immune system that works a little bit differently, you can't just throw supplements to an autoimmune patient are going to boost the immune system. We have to talk about modulating or balancing and optimizing immune function, because you don't want to boost it so high in someone whose immune system is already overreactive. So when we put this list together, we really kept in mind that these are relatively safe for people to take, and these are common ones that people might be deficient in. The immune system might be yearning, with vitamin D. We're not outside as much as we used to be, so these are things you really need. And when we talked about the gut, that's where that anti-inflammatory effect comes in. Turmeric is an incredible anti-inflammatory herb. I give it to a lot of pain patients as well as people who are just looking to, optimize their health. Fish oil actually has some incredible anti-inflammatory benefits as well. You guys probably hear about EPA and DHA being two different types of fish oil. DHA is really great for brain inflammation, EPA really good for whole body inflammation, and most fish oils that are of good quality will have a little bit of both. And then adaptogenic herbs goes back to when we were talking about general factors that affect the immune system, and we're going to get a little bit into lifestyle right after this, but anything that taxes the entire system taxes the immune system. So adaptogenic herbs, all they do is help the body handle stress better. And that's physiological stress, that's emotional stress, that's, physical stress. They help the body work better. So if you think of, when you need to put oil on a squeaky wheel, that's what adaptogenic herbs do. They just help an already functioning system function better. And that's really the way you want to go about immune health, is dealing with anything that's underlying and helping to optimize the system. Let's go to the next slide. Perfect. So that leads us right into lifestyle. So when we talked about factors affecting the immune system, these essentially line up perfectly. Adequate nutrition, Tina will go a little bit more into, but I want to go back and really hammer in that point that every single bite you take can either fight disease or fuel disease. It can either fight inflammation or fuel inflammation. And so we have an incredible ability with our lifestyle to really optimize the performance of our entire system. And that should be an exciting thing. On my website, you guys can download the best foods for the immune system. There's some really good information that Tina's also going to go over about specific nutrients and foods that you can incorporate that help with immune health. This one I want to skip over. It makes me so sad, minimize alcohol intake, but that is something that, alcohol in large quantities does promote a lot of inflammation in the body. So it's dose dependent, just like everything else. Optimizing sleep. There's been so much research on sleep, particularly lately, in decreasing inflammation, in helping just create a time for your body to recover if you're losing sleep. And actually, women are more affected by loss of sleep than men. Not that men are not affected, but women's physiology can have more of a change with sleep deprivation. So we want to be mindful about that. Exercise that helps enhance the system and not take away So something you really enjoy. You know, not all of us can do the type of exercise we've been doing before this pandemic happened, but even getting outside and doing, you know, a quick walk morning and evening is going to do something for your body. And stress management, there's a ton of incredible stress management techniques, but I want to kind of switch everyone's focus to, we're not just talking about mental stress. We need to have an awareness that any type of mental stress creates a physiological response in the body that can weaken the immune system. So we want to take care of all types of physiological stress. And of course, I had to put in here that acupuncture is an incredible stress management tool. There's been a ton of research on it. It is considered essential healthcare, so you can see your acupuncturist right now. And it's great for helping with inflammation. So I like to explain acupuncture as an adaptogenic medicine. So just like we talked about herbs, adaptogenic herbs helping promote the function of the entire body, acupuncture does the same thing. And Dr. Tina is going to get more into how to go about identifying toxins and doing your best to remove them.
All right, so yeah, the few things that I wanted to also touch on that Dr. Nell touched on are, for example, for adequate nutrition, one component can be fasting. And what fasting really does is, I have one of the genetic tests that I do for my patients that identifies whether a patient would be ideal for fasting through their genetics. What it really helps to do is to clear any toxins from our cells. It really gives our body time to take a break from digesting food and to concentrate on just clearing out the cell through a process called autophagy. Some of the best foods for the immune system, like Dr. Nell mentioned, she does have a list on her website, so definitely check that out. But one thing I really wanted to touch on is, you know, things like berries have antioxidants. Fish is a really good source of vitamin D, selenium, other nutrients. And then the other important thing I wanted to touch on is something like, for example, garlic. This targets multiple inflammatory pathways. So of course, again, there is a time you have to take an ibuprofen, but over time, if you're able to incorporate a better nutrition that has foods with antioxidants and are anti-inflammatory, this is going to help to make an overall compound effect on your immune system instead of something like ibuprofen that targets one inflammatory pathway. The next thing I wanted to touch on is optimizing sleep. So again, while we're sleeping, our body is fasting. So it gives our cells time to clear out anything that's not serving our body well, and then also really gives our body time to recover. And as far as identifying toxins, so for example, if you smoke, you know, it would be a good time to work with a practitioner to kind of wean off of that. And anything else, you know, working with a practitioner can be really helpful too, to identify if you've been exposed to mold, things like that. And let's see. Okay, this next slide speaks to genetic testing and the immune system. I'm not going to go through each one of these points, but the main point here is that working with a practitioner to find out things like what essential vitamin pathways you're deficient in is going to be really helpful to individualizing your care. We're bombarded with so much information and so many health tips, and we think we need to incorporate it all, but working with a practitioner can really help you to see, okay, where are you deficient and what can you be doing to individually make your health better? And then the last thing that I wanted to touch upon is this fascinating concept of epigenetics. So you'll see on the left-hand side of the slide, it's a lot of inputs. So your environment, your nutrition, are you exercising? All of those things are your input into your body's outcome. So ultimately, this is the concept that whatever you're putting into your body can turn your genes on or off. So an example of this is, for example, you do a genetic test and you find out that your autophagy genes, the genes that we previously spoke about that help to clear out your cells, are not working optimally, then you know that taking a turmeric supplement, for example, is something that will individually benefit you. So yeah, again, it really helps us to individualize our care and know which genes we need to work on altering. And there's a lot of scientific evidence behind this. I mean, even if you just Google it, there's a lot of information on how we are now able to kind of change our own genetics by learning what we're deficient in or any diseases that we're prone to.
Okay. And the last piece of this that I wanted to touch on was underlying conditions. You know, with all of the talk around this pandemic, it's, you know, there are a lot of factors that go into who is this affecting, whose immune system is compromised, how can we predict a lot of this, how can we prevent it, and, you know, a lot of fear and misinformation around that. But, you know, I think something that everyone can agree on is the healthier you are, the healthier you will stay. So we can't, you know, 100% guarantee anything, but keeping underlying conditions in check, making sure that you are treating any underlying conditions and not letting things fall by the wayside because you've become hyper focused on the immune system is really important. And what do I mean by underlying conditions? I mean the stuff that we all kind of brush off. Like we're like, oh, I know I have this thyroid condition, but there's other more important things going on right now. And I know, you know, stress is making my arthritis worse, but I can't really treat my pain right now. Well, anything that's going on in the system will affect your immune system. So it's really important to identify what those underlying things are that could be, you know, causing you to function in a suboptimal way. You know, we get really used to like the new level of normal. We are innately adaptive as human beings, which is a wonderful thing. But at the same time, it makes us also kind of push things to the wayside that we should probably be focusing on. So something I do when I work with patients is a lot of this blood testing in order to see, okay, what are these underlying triggers? And then I use, you know, different holistic modalities from acupuncture, supplementation, herbal medicine, to help push that treatment plan forward. And then we can retest and see, okay, how well did this work? But in that we're talking specifically about immune system, we can test for things like things that are irritating your gut, dietary wise, any environmental toxins you've been exposed to, bugs or, you know, chronic infections is what I mean by bugs, and then hormonal shifts. And, you know, women have a lot more hormonal shifts than men. It's not really a coincidence that we see autoimmune disease more in women than in men. There's absolutely a correlation there with the amount of hormonal shifts that we have as women. So these are all things to be aware of and all things that can be very much affected by our lifestyle and our ability to properly recover. And like Dr. Tina said, you know, this should all be customized to you as an individual. We gave a lot of stuff that, you know, everyone can be focusing on that's going to, you know, give you the biggest bang for your buck. But if you're really looking to dive into what are my underlying conditions, there's a lot of ways to, you know, go about that. And the genetic testing with Dr. Alidad is one of them. I'm happy to do a consultation with anyone as well. And we can go to the next slide or 2 slides. But we wanted to, like we said, keep this nice and short. So we did under a half hour because I want you guys to all have the opportunity to ask questions. I know everyone has different concerns when it comes to their health. So yeah, thank you so much for listening to us, and we're happy to answer anything. Was there anything you wanted to add, Tina, before we did questions?
No, thank you everyone for joining, and thank you for your time, and we're looking forward to taking some questions.
Yes.
And I just want to say thank you really quickly as well. I know you've both taken your time on a couple of different occasions for sharing this information with the chamber, so we appreciate it. And with that, I think our group is manageable enough where if you just want to unmute yourself to ask a question, feel free, or you can ask it in the chat.
Great.
I have a question. With ibuprofen, say you're up at 2 a.m. with a headache or something, and you want to reach for that ibuprofen, is there something else that might work as well that would be, less problematic?
So Tylenol, generic name acetaminophen, that does not affect our gut as much. So ibuprofen tends to affect our gut lining, especially with chronic use, whereas acetaminophen does not. Acetaminophen, Tylenol can be used for a headache. It's not going to help with inflammation. So the two big differences between Tylenol and ibuprofen are that ibuprofen helps with inflammation and Tylenol does not. But they both do help with both pain and fever. So Tylenol would be a better choice.
Okay. And I stopped taking Tylenol because I was reading about liver damage. Is that something we should be concerned about with Tylenol?
Not so much unless you're taking upwards of more than 3,000 milligrams per day, which I imagine you're not, because it comes in like 325 milligrams and 500 milligrams. So that's going to be a safer bet, especially for the elderly population, because your stomach starts to get so sensitive. The acid's already decreasing with age in our stomachs. So the Tylenol would be a better choice. And again, just make sure that you're not going over the 3,000 milligrams. And that is dosed every 4 to 6 hours.
Perfect. I don't take it very often at all, maybe once a week or twice.
Yeah, no, it would really take a lot of Tylenol to cause liver damage.
And chronic use.
Exactly.
Yeah.
Exactly.
Thank you.
And Deb, I would also say, it depends on how severe. You kind of got to manage that. I agree. Tylenol would be your better bet. But a really good high quality turmeric supplement can also help. Of course, plug for, you should be looking at what's causing the headaches to begin with, particularly if it's at a point where it's waking you up at night. But because turmeric does have that anti-inflammatory effect, and a practitioner would be able to tell you if it's more due to inflammation or if there's something else going on causing the headaches. But that's been something that's been helpful, particularly during the night, because it's not going to like stimulate you or keep you up. Some people do well with caffeine for headaches, but that's not obviously a good go-to in the evening.
Right.
Yeah, and that's also a good point by Dr. Nell, because turmeric can be taken on an empty stomach. So the ibuprofen you shouldn't take on an empty stomach. It should always be taken with food, and I imagine not at 2 a.m. on an empty stomach.
Right. Is there, I know I don't want to put you on the spot, but is there a brand that you recommend as high quality for the turmeric?
Yes, but you would need to go through a practitioner, or you're going to be paying like black market prices on Amazon, because it's not supposed to be sold to general public.
Okay.
It's called Tumero XL Active by Apex Energetics. I actually can type that in the chat as we're going. I like this turmeric specifically because it's emulsified, and it's in MCT oil. So it takes care of the fat soluble part. You're going to use the fat as a carrier, and it's going to get into the system very quickly, which is why I like it for more acute things. And as a really random but cool case study, I went to a seminar once, and we had samples of all these different products, and a woman who had had chronic pain and trigger finger for a year couldn't get anything to touch it, and did 2 doses of this turmeric, and it was gone for the rest of the day. So if you get a good high quality supplement, and that's what your body needs, like it's, a good fit for you, you can get good results.
Thank you.
No
Can I ask a quick question on that?
Mm-hmm.
So what about just,
Michael, I think you muted yourself.
Yeah.
Yeah, I was like, wait.
sorry.
I was on the edge of my seat. What about?
And that's all I have to say about that. No, I was gonna say with regular like raw turmeric or turmeric powder, is it not enough to have that type of normal concentration, like a half teaspoon in the morning or something?
I'd love to hear Tina's opinion on this. My opinion on it is that it is good for an overall health and overall anti-inflammatory effect to be incorporating raw turmeric or ground turmeric from like a dietary perspective, you're still going to get some immune benefits from that. I haven't found it particularly effective for pain relief specifically.
Okay, so I completely agree with that because I do take, I think it's a teaspoon of organic turmeric in like a little shot every morning. And I've noticed it's done things like make my skin look better, and it has helped with inflammation. But if you're looking to get more of a like medicinal impact from it, the spice is not going to help as much. Incorporating in your foods will help, and help with small things, but if you're looking for it to have a bigger effect, such as helping with headaches, I do agree that it's going to be in supplement form, because then it's like dosed out for that indication. Whereas when we're taking a teaspoon, for example, it can have small benefits, but not on that large of a scale.
Dosage is everything.
Thank you.
Any other questions?
Turmeric lattes, I've been making those at home just with like organic turmeric and, coconut milk. I don't know if it's doing anything, but they taste good.
No, same thing. Like you're going to get some benefit from it, not a medicinal level, but certainly an overall body support. Yes.
Okay.
Agreed.
Thank you.
It's better than, a Frappuccino for sure.
Do you guys mind just weighing in also on coconut oil? I know that's a wide subject.
Yes.
Good,
I mean, I can give you my top 3 thoughts on coconut oil in general.
I hear it's great. I hear it's not so great. Go ahead.
Okay. I like coconut oil for brain patients. So I prescribe coconut oil or MCT oil to Alzheimer's and dementia patients because it can be extremely helpful with brain inflammation. And just like, your brain loves healthy fats. As like a general health, people who are high dosing on coconut oil, I feel very similarly to like how I feel about keto diet. And that's another can of worms. I think keto diet is medicinal. It's very hard to do correctly. So I think coconut oil in moderation, or certainly is like a substitute for like those really high processed vegetable oils, is great. But it's more at high doses medicinal for certain people only, because there are risks that come with overusing coconut oil. So.
Yeah, and just to add to what Dr. Nell said, when she's speaking about being good for the brain, is what's surrounding our brain, our blood-brain barrier, it's called, is essentially made of fat. So those healthy fats can easily cross that brain barrier. And my husband actually uses MCT oil a lot. Nell mentioned it, and he says the same thing. He gets that kind of same effect where it like really helps his brain to work optimally. The other thing I wanted to say about coconut oil is it is one of the oils that can be used for high heat cooking. So a lot of people tend to cook or sear with olive oil, and olive oil really should not be used for high heat cooking. It really ideally shouldn't be used for cooking and getting it hot, because it does it changes the molecular structure in a way that can be toxic. I'm not saying it absolutely is, but it changes the way that we're supposed to process it in our bodies. So if you're trying to figure out whether you should cook with coconut oil or with an olive oil, coconut oil is going to be a better way to go, as well as like an avocado oil. Avocado oil is also great for cooking, and especially high heat cooking.
That's such a good point. I'm glad you mentioned that.
That's fantastic. Thank you both.
You are very welcome.
Michael could weigh in on this, because he mentioned, when you mentioned fasting, I think you mentioned to me, Michael, that you were trying the fasting by eating in the afternoon and then not eating again until late the next morning. Do you ladies have a suggestion on the best way to incorporate fasting? Would it be over a period of several days, or just during that evening period?
I've found with my patients that first at like fasting it for like 12 hours, then for 10 hours, then over time, try the 8 hours. I know especially with intermittent fasting, it's supposed to be eating in an 8-hour period and then fasting the rest of that time. It's going to be best to do it with a practitioner so that you're not, you know, crashing or anything like that. But it's going to be important to do it over time, and then also to make sure that you're getting the adequate nutrition that you need during the time that you are eating. So it's kind of tricky, but again, it can be really beneficial for helping your body to get the time that it needs. And the patient that I did it most recently with said that she really feels so much less like arthritis pain from fasting, and especially from turmeric supplements as well.
And what I would add to that is, I mean, along the lines of, you know, it is customized for everyone. And I know Tina does the genetic testing to see what's optimal. There are also different ways to incorporate fasting based on what you're trying to treat. So if you're trying to fast because you have Alzheimer's or dementia and you're concerned about that, that's going to be at a different level than if you are fasting for overall inflammation and longevity. And you know, I agree with Tina that like 12 and 12 is a really easy way to start, because you're not really skipping any meals. You're just making sure you're not eating late. And, you know, the body's physiology changes in the evening, and it does not break down food well late in the evening and into the night. It wants to be in that recovery state. So, you know, if people are doing intermittent fasting, I like the idea of just skipping breakfast, but like finishing meals by 7 p.m. so that your body does have time to really get used to that. And I also agree with what Tina said about, you know, you want to work with someone because it can be very difficult to get into a comfortable state with fasting. You know, there's like extreme medical fasting where I have patients who have diabetes and they're on a ton of insulin, and, you know, they can get off insulin in a few weeks incorporating fasting, but it has to be done properly, or people, you know, get really sick. The same thing with like going on the keto diet and people get this keto flu. It can be the same thing with fasting. It's just your body needs time to get used to it. So 12 and 12 is super safe, super easy. I haven't seen anyone have a really hard time incorporating that or getting sick from that. But yeah, making sure, you know, you go with what works for your body and working with someone who can help you address those individual goals that you're trying to accomplish with fasting, I think is important.
Yes, and real quick, I'm very glad that Dr. Nell touched on this, because there is going to be an ideal time period. Like, for example, I personally do it from 12 to 8 p.m. is my eating period, and then the rest of the time I'm fasting. But she's totally right on the fact that if you're doing it late into the night, I forgot where I recently read this. I know that it was a Harvard researcher had said, basically, if you're eating too late at night, you're not letting your body go into the process of the autophagy, of the cellular cleansing. And the way that he explained it was that if you're eating and then, you know, even an hour after you're going to bed, you're not giving your body the chance to take out the trash while you're sleeping. So just be careful of when you're doing it and what time periods you're eating, so that your body is being able to recover at night.
Can you tell that we love talking about this? The one thing I wanted to add, you guys, if you're fasting, intermittent or otherwise, hydration is going to be a huge issue and a huge thing you have to focus on, because we get hydration from our food. And if you're not having food, you absolutely need to hydrate. And, you know, if we're not fasting properly and not hydrating properly, there's also going to be some electrolyte imbalances in there. And so a lot of my patients will need to add a little pinch of salt, like good high quality salt, to their water in the morning. And again, it's like, it's individualized for everybody, how that works best. But, you know, hydration is key for everything that we do, but particularly when you're fasting.
Absolutely.
Thank you.
Anything else, anyone?
So you have me intrigued by the fasting aspect of it. I don't know if I missed it, but if somebody has a normal sleep schedule, let's just say from 10 p.m. to 6 a.m., what would be then the latest that you'd want to consume food?
I like 3 hours before bed. if I was going to give a general blanket, you know, for, yeah, the person who's going to bed at a normal sleep time, you're going to be feeling pretty good with 3 hours. And you can take some time to get to that place, because a lot of people are like, whoa, that is kind of crazy to me. Like, I'm used to having my like evening yogurt and berries or whatever right before I go to sleep. Again, you want to like back that off slowly, but in a perfect world, it would be like nothing except for water 3 hours before bed. What do you think, Tina?
Yeah, I do agree with that. Again, that's what patients as well is like, try to keep them a few hours before so that their body is able to digest the food, and then they can enter into that fasting state and recovery state during their sleep.
Thank you.
No problem.
Anyone else? Oh, Jasmine said, I love intermittent fasting. I do 16/8 or 24. Yeah. Which I know probably sounds crazy to a lot of people who haven't done intermittent fasting before. They're like, what do you mean you don't eat for 20 hours? But your body does get used to it.
Absolutely.
And, you know, it can be an effective weight loss tool until you get too close to your goal weight or what your body wants. Kind of no matter how you're doing it, that last like 10 pounds or whatever is always difficult. But fasting can be very effective at putting the body in an optimal state, because it is cleaning out old cells that are not doing their proper job anymore.
Definitely. And one other thing to keep in mind, if you know you happen to tell family members about this or friends, I think Dr. Nell touched on this. It is really important that, especially if you have an underlying condition or pre-existing condition, that you're doing this with a practitioner and not just, you know, deciding to fast and you take your insulin and your blood sugar drops. You want to prevent any of that from happening. And then also women that are around childbearing age, when you get close to wanting to have children, it's not a very ideal thing to do. So yeah, just, it's really important to kind of research and work with a practitioner to figure out, okay, how would it be ideal for me as an individual before just trying it.